Bipolar disorder or manic depression appears different in every person that suffers with the disease. Most bipolar sufferers share the experience of extreme mood swings, and they all have an understanding of and experience with depression and mania. However, that's often where the similarities stop. Mania and depression exhibits differently from person to person. Both depression and mania can be considered spectrum symptoms. The reason for this video is to fight the ignorance spread by media, social media, and individuals and celebrities sharing content on the bipolar disease while having very little to no knowledge or experience with it. Take away these things from this video. 1. Not all bipolar people are criminals, nor should you fear them. Doing even a small amount of research into criminals and crimes, from physical violence to emotional abuse, shows the majority of people convicted are considered normal and do not suffer from bipolar or any mental illness. 2. You spreading information based solely on your experience slows progress, stigmatizes sufferers, and makes you look stupid, especially when the only knowledge or experience you have with the disease is knowing one sufferer, or worse, it's information you picked up from a meme. 3. Do not use bipolar as an excuse for criminal activity or hurtful behavior. Using bipolar as an explanation to why you suffer and why you struggle with some things is perfectly acceptable. But do not use the illness as a shield to protect you from the consequences of your actions. This is especially true if you have never actually been diagnosed with the disorder. So many people, especially online, self-diagnose, then use their diagnosis as a way of getting away with inappropriate and harmful behavior, as well as the hurtful treatment of others. Some can have depression in the sense they become melancholy, void of energy and interests, as they maneuver through their daily lives still carrying out their duties. Others can have it so bad that the brain starts to send out ideations of violence toward themselves and others. Mania can vary from being hypomanic, which is considered light mania, and barely there, causing a light unease physically, with manic symptoms on a small scale, hardly disrupting the person and their life, or it can be full-blown and cause severe physical distress, while also taking a toll on the person's behavior, causing issues with their financial stability, irrational fear leading to unnecessary actions, irritability that can affect their relationships, rage that can cause physical altercations, poor and impulsive decision-making leading the person to be in dangerous situations. It can cause sexual, financial, and physical recklessness. Some specific symptoms it will cause in some, but not others, include insomnia, lack of appetite, delusions of grandeur, visual and auditory hallucinations, rapid speech, flight of ideas, excessive energy, goal-oriented activities, paranoia, the desire to run, jump, or scream, illogical thoughts, cognitive impairment, and more. Never compare one bipolar sufferer to another. You may know of a high-functioning bipolar person and have a hard time understanding how another person with the same disorder acts completely chaotic. I have been told I know a bipolar person and they can hold a job. I know a bipolar individual and they never raise their voice. My family member has bipolar and has never been suicidal. To that, I say, so what? Bipolar disorder is not the only thing responsible for a person's personality. Just like non-sufferers, some people have morals and others don't. Some have suffered trauma that leads to altered perceptions, and others haven't. Just like saying I'm holding an item and it's blue in no way actually describes that item, as there are many shades of blue. In addition to bipolar being a spectrum disorder, it can easily be misdiagnosed simply because even professionals have a hard time identifying true symptoms. Some hospitals and psychiatric specialists say if a person suffers from one manic episode, they must be diagnosed with bipolar. However, well-educated individuals understand that mania can be triggered by other things, and one episode is not enough to diagnose someone with a lifelong severe diagnosis such as bipolar. Mania can be brought on by stress, lack of sleep, drug abuse, miscarriages, and other physical medical conditions, and even the change of season. It can even be mistaken due to how it is explained to the professional by the patient. Terms such as "I couldn't help myself," "I felt great at the time," and others are not enough to be labeled as mania, but sometimes are. So this high-functioning bipolar person may not have a mental illness at all. Depression is not limited to people with bipolar. 1 in 4 people will struggle with clinical depression sometime in their life, some once and others chronically and repeatedly. Phases of depression without clear episodes of mania should never warrant a diagnosis of bipolar, but sometimes do. I have suffered with bipolar for over 35 years, and I have never experienced any type of hallucinations, where I have experienced rage to the point of being homicidal, while other sufferers will attest to the complete opposite. This is why a mood journal taken for 1 to 2 years is vital in diagnosis. My followers have heard me say this many times. Any professional given a diagnosis of bipolar without an in-depth evaluation of over a period of at least 1 year isn't a professional and is probably going to misdiagnose. Do not pretend to understand an individual's illness based on one aspect of another person's life just because that person claims they are also bipolar. Do not take to heart any comments spoken by someone comparing you to another person who supposedly has the bipolar too. You do not need to justify your disease to anyone, especially if you have gone through all the proper procedures to receive a valid diagnosis. As always, I will end on this note. Do not self-diagnose. Do not diagnose yourself due to memes you feel you can relate to. Do not let others that don't have a license in psychiatry diagnose you or give any opinion or advice on the disease. Do not let a professional diagnose you without an in-depth mood journal being kept for at least 1 year. This has been just another spew from Bipolar Me.